kick it off with a definition of who community health workers are. CHWs, they are trusted members of the community, and they often share a unique understanding of the experience, language, and culture of the people that they serve. So this term by the American Public Health Association defines CHWs as those individuals who are in the community that they build that trust. That's the most important thing about CHWs when looking to implement them into organizations and programs is they have the connections with the people, they have built the trust, and they have this unique understanding of the experience, the language, and the culture of the people that they serve. They also have a very deep knowledge of the resources, the relationships, and the needs of that community because they live in that community. They've engaged with those individuals in different variety of organizations. And so this trust and this relationship, it enables that CHW to serve as a liaison, as a link, as an intermediary between the health social services of the community. Next. So let's jump into the evolution of CHWs. So when looking at how did CHWs come about, starting in the 1950s and 60s, CHWs addressed these basic health concerns almost, 50, 60 years ago. And so the most well-known of these earlier programs, it points to the Chinese barefoot doctors. And these doctors acted as that primary healthcare provider in the rural communities where they were perceived as peers because of their continued engagement in farming. And I know many of us can kind of think about that in our own lives, those individuals who are in the community that that many people go to. So by the 1970s, CHWs became a rallying voice within the APHA era with the CHW-led section. Then we jump into the 90s where the National Community Health Advisor Study helped identify those core roles and competencies and qualities of CHWs. And that's really where we see deep work happen to and those competencies. With little existing literature of the role of CHWs in healthcare, this study actually provided guidance to policymakers and practitioners on a number of different areas that could help improve the status.
Is it just me or did Tasha freeze? I think she froze. Will y'all let me know in the chat? She froze, okay. Let's give her a few seconds to see if she'll come back. If not,
Did I freeze?
You did freeze.
Can you hear me?
Yeah, we can hear you now. You froze. Let's see how, if it does it again, we'll get you on the phone, but keep going now.
Okay, alrighty. And so in 2007, we saw that the Health Resources and Services Administration provided a comprehensive CHW workforce. So the healthcare costs were high and CHWs were beginning to be seen as a very cost-effective solution and way to address these health concerns in these underserved communities. The Bureau of Labor Statistics assigned an occupational code to CHWs in 2010. And so the interest for CHWs started to soar during this era and programs began to grow. We saw a demand to see CHWs implemented in a variety of different other programs. And so then we saw an assignment of an occupational code, which actually made the exchange of accurate information more timely. So fast forward to about 2010, we saw CHWs, they had that occupational code in the BLS, and then the CHWs workforce started to grow. And now fast forward to 2025, we have CHWs employed in every state of the US, and 24 states can file for Medicaid reimbursements of the CHW services.
So let me go ahead and jump on this. Tasha, you keep glitching. Go ahead and jump on your phone for me. And while you're calling in, I'll go ahead and take off this over the slides. She had some, I don't know if y'all know, but here in Texas, we had some really bad weather. And so she's had some connectivity issues all morning, but that's okay. She's gonna call in on her phone. I'll go ahead and take over for now. So thank you for bearing with us. All right, let's talk about core skills and competencies. And so Tasha just talked about really kind of what made things possible to get to the CHW profession to the point where it's at now. And what I like to say is CHWs possess a multi-dimensional skill set that really allows them to do all of those different things that we've talked about and to do the things that you see on the slide. So CHWs must become masters of core skills and core roles. And so when we talk about the core skills, we're talking about competencies, which form the foundation of the work that CHWs do, enabling them to effectively connect with individuals and communities, enabling them to navigate healthcare and social service systems and promote health equity. I like to say CHWs are the profession that make health equity possible. And so the core skills, which you see to the left of the screen here, include communication skills, interpersonal and relationship building skills, service coordination and navigation skills, capacity building, advocacy skills, individual and community capacity, individual and community assessment, outreach skills, professional skills and conduct, evaluation and research skills, and then having that knowledge base when it comes to healthcare issues and societal issues, et cetera. The core roles represent the main ways that CHWs can serve their communities. I'm not going to read all of those. What's important to note about the core roles is most of the time you don't just see a CHW working within one role. Often you see a CHW serving in all of those or several of those roles at the same time, which is perfectly fine for them to do so, again, because they have such a multi-dimensional skill set. Now, you've got the PDF copy of this slide deck, and if you'd like to get the source or citation for any of this information, just click on the word source in the bottom right corner. It's going to take you to the c3council.org, which is where you find national recommendations for these core skills and competencies. Again, we'll go more into that in next week's webinar, but if you'd like to get a head start on that research and you're not familiar with the C3 project or the C3 Council as it's called now, you can go ahead and do your research prior to next week's webinar. And I'm not sure if I see her in yet, but I'll just keep right on going. All right, so let's talk about how CHWs serve. Community health workers serve primarily in 6 main program models at Umemba Health. We like to call these career pathways because it just sounds and feels better for me. But they work by engaging both the healthcare provider as well as members of the community to work in partnership toward better healthcare outcomes. And there she is. So you've got the Promotor de Salud or lay health worker program model or career path. And this is where you have promotores who are the bridge between the diverse populations they serve and the healthcare system. This model is often used in the United States and Latin America to reach Hispanic communities. And it is most effective when promotores are members of the target population, not just people that speak the same language or share some of the characteristics, but really come from the community in which they're going to be serving, those that they're going to be working with on a day-to-day basis. The second model is the member of the care delivery team, and this is where community health workers are collaborating with or alongside medical professionals in a clinical care team. This is actually where, as a nurse, this is where I flourish and have the most experience working with CHWs when it comes to team-based care. So collaborating with medical professionals, community health workers can offer a number of different services. We won't go into them today, but you see this as a model that's becoming more and more popular as we're integrating CHWs more in clinical settings. The third program model is care coordinator / manager. This is where CHWs are helping individuals helping individuals with complex health conditions navigate the healthcare system. So they do a lot of advocating. They serve as a liaison between the patients and a variety of healthcare and human service agencies. In this model, CHWs really do need to know and understand the local resources that are available in their community so they can make the appropriate referrals and navigate individuals to the appropriate resources properly. The fourth is screening and health educator. And so in this program model, you have CHWs that are delivering screenings and health education to the target population. They may provide health education related to disease, prevention, and healthy behaviors, but on a variety of different topics. So I know I've worked with CHWs that worked in asthma programs, that have worked in diabetes self-management education programs before. We've done stroke rehabilitation, we've done smoking cessation, I mean, the list goes on and on. For every chronic condition, I've worked or supervised a CHW in that area before. So with this particular model, CHWs do need to be trained often on the chronic conditions, on just kind of the new trends on treatment and management. They also need to attend trainings on cultural competencies so they can provide health education that's effective for the population that they're serving and also sensitive to the patient's values and experiences. For the fifth program model, we have outreach and enrollment agency. And so this individual helps to enroll people in programs like healthcare programs, social services, SNAP benefits, affordable care, things like that. They do a lot of outreach efforts. You'll see this individual work inside of going to do home visits quite a bit. They can work with patients to identify issues like social isolation or loneliness, right? Sometimes our senior population, they don't necessarily eat because they're not hungry. They don't want to eat alone. And so CHWs can identify things like that. And maybe the intervention is, I'm going to visit the home during the mealtime so that he doesn't have to eat alone. As outreach and enrollment agencies, CHWs may visit hard to reach populations, which is why they are ideally suited in some programs, especially programs that entail home visits. And then last is the community organizer and capacity builder. These individuals build relationships with a variety of different individuals and organizations through community organizing and capacity building. This individual that is serving in this role needs to have an extensive knowledge of the healthcare system and the different organizations and really the champions in the community. They need to be well-versed in different social and support services of the target population, and they have to feel comfortable engaging with the public and articulating their ideas in front of groups of people, networking with shareholders and with other partners. I mean, this is the go-to person. And so that's a little overview of how CHWs serve. Again, just like when we talked about the core skills and qualities, you might see a CHW that serves in all of these program models, or you may see a CHW that specializes in really one of these program models. It just depends on the work environment and the setting in which they're employed. Tasha, are you back online now? Let's see.
I hope so. Can you hear me okay?
We hear you. We hear you very well. You want to take it over from here?
Yes,
All right.
thank you. Sorry
Sure.
about that.
That's okay.
All right, so where do CHWs work? Here we have two graphs where you can see the industries with the highest levels of employment for CHWs. Here at the top, we have our local government. And so I kind of want to spend a moment to talk about that for a minute. So overall, the Bureau of Labor Statistics has about 63,000 CHWs nationally. We know that there are way more CHWs doing the work than just that number. And where you see the local government, I want you to think a little bit about how CHWs are currently being utilized, and even the last 5 years of when COVID was here. And so we started to see many public health departments utilize CHWs for the services of boots on the ground in the community, providing health education. And over that time, even a lot of resources, research, toolkits have been developed to expand how CHWs have been used in the local government. So think about your local health departments and think about other ways in which you locally also may be seeing those CHWs. So you can see here that is a large percentage of the employment. Also, the individual and family services, general medical and surgical hospitals, our outpatient care centers, and then our office of physicians is kind of at the lower bottom area, but that means that there's room for expansion with that. And so don't necessarily just look at that and say, okay, they're at the bottom with the office of physicians. We're starting to see an increase and an uptick kick with that number. But let's move on over to the industries with the highest concentration of employment in community health workers. So you can see the grant making and giving services employment is at about 1350. Our social advocacy organizations at 1930. So these organizations are the ones that are working in policy, that are making sure that their benefits, for individuals are being taken care of on a legislative level. You can also see the community food and housing at about 1570, such an important way that we're seeing CHWs also implemented in that sector, outpatient care centers, and then individual and family services at about a little bit over 10K.
And I like to interject.
And so
here. I'm sorry. Before we go ahead, and I want to say something before I forget it and we go to the next slide.
Oh, go ahead. Go ahead.
So, we teach CHW students, and so I'm always learning like what's going on in the industry from our students. And I wanted to mention, even though, all the information, like you said, cannot be captured here. The whole number of, CHWs and things are not captured here. And so I've learned of some interesting places where they're starting to integrate CHW. So I don't know if dentist offices is on here, but that is certainly one place that I'm hearing of. And I think this second place is so cool. I believe it's San Antonio, and I know I've got some people in San Antonio here. You can vouch for me if you're aware of this, but they are now putting CHWs where you go and pay your utility bills. Because the thought process is, if you're having a hard time paying your gas, water, electric, what have you, then there are some other social service needs that you could potentially use as well. And so even though we're providing these stats that come from the Bureau of Labor Statistics, and they're always a couple of years old, I still want, you all to understand that the different industries are now using CHWs more and more. I've seen CHWs at tech companies. I'm seeing them at pharmaceutical companies, of course, insurance companies, which I'm so surprised is not on here because that number is really increasing. So CHWs are now being utilized across various industries. Here's a great comment. Tiffany said, I'm fighting to increase the presence of CHWs in our prisons to assist citizens with re-entry into society. I mean, there's not a place that I can't think of that we cannot utilize and integrate community health workers. So anyway, I get excited thinking about that, and I just wanted to share that information before we went further. Thank you for your comment, Tiffany.
I think that's a great point. I think that is a great point to think about the evolution, but also where can we go with CHWs? I love that. So let's look at the impact of CHWs. And so we like to say that this is the value-based care. So there have been several research that have showed that CHWs reduce unnecessary emergency room visits, they improve chronic disease management, and also impact health outcomes, all which have saved healthcare dollars. In fact, for every dollar invested in CHW intervention, there would have been a $2 to $4 return. And that's an average of $2.47 return to the average Medicaid payer within the fiscal year. So this is why regulatory shifts with CHWs is favored. States have increased formalizing CHW roles, integrating them into value-based care models, and opening up new funding sources. And so, when you look at the impact of CHWs, you don't only just look at, how they're engaging in the community, but you're also looking at the bottom line dollar of what they're contributing. And you can see here, that's almost a $3 return. And we're never mad.
Uh-oh, she froze. She'll come back. Let's give her a few seconds. Okay. Go ahead and finish up, Tasha. Can you hear Tasha?
Yes, I can hear you.
Okay, you did freeze, but I think you were finishing up this slide. So we heard.
Oh, okay. CHWs are never, we can never be mad at how CHWs can save money. And so CHWs are the future of healthcare. They've proven to be essential members of the healthcare team, of a collaborative healthcare team, particularly in diverse and rural communities, and options for reimbursement for CHWs should be considered integrated within their healthcare community. Next slide.
Yeah, and I also like to say, and I don't know why I didn't put this in the notes, but we provide a training called the 6 Rights of CHW Integration. It is very specific for healthcare settings. And so if you are interested in knowing what those 6 rights are, or having one of our consultants speak at your organization about the 6 rights and making sure that you have all 6 of those components to fully integrate your CHWs appropriately, please contact me about that. And we can put something on the calendar and share that information.
So when we talk about CHW integration and team-based care, one quote that Quisha always says is, there are enough professionals taking care of patients' medical needs, but not nearly enough professionals to take care of a patient's social needs. And I think that's something that many of us can relate to when we're engaging with community partners, engaging with patients, and knowing all of the social needs that a person has to have to be successful and be well. And so team-based healthcare is a provision of health services to individuals, families, and or their communities by at least 2 health providers who work collaboratively with patients and their caregivers to accomplish shared goals with and across settings to achieve coordinated, high-quality care. And these teams can look very different. Some organizations may include a team that consists of a physician, a nurse. Me, myself, I have personally worked with a multidisciplinary team, and I can say how impactful that is with working with patients with more than one healthcare provider. An example of that is, there's me, the CHW, but I've also, on our team, we've had an exercise physiologist, we've had a dietitian, we've had a clinical social worker, we've had the physician. So the CHW would go in before the physician and check and see how everything is. Then I would report back to the physician. They would do their assessment. And if they needed any other needs or needed to check in with any of the other healthcare professionals, they were able to do that. And we would see our patients soar with their wellness and be very successful, but not only with them, but also their family, because at the location we were also attached to a recreational center. So, you have people that may have chronic diseases and they may need to work out, or they may need to, have their children with them because of other social determinants of health, barriers, transportation, and you can see the
Oh, you can see the impact in their lives. And I will agree, until we get her back, that team-based care, multidisciplinary care is where it's at. I know for me as a nurse working alongside a team that had a dietitian or a diabetes educator, and of course the medical professional, maybe I had an MA, medical assistant, and also a community health worker, it allowed, I believe, me as a nurse, it gave me more time. I know it gave the physician more time because there were things that we did not have to worry about. As a nurse, I didn't have that much time to help them fill out an application or to provide a breakdown of the, normally we would give them a list of foods they should eat or foods they should avoid. Whereas the CHW can share and spend that extra time with them to go over, the diet, the medication, to follow up appropriately, to do the kind of wraparound services. So it allows everybody on the team to work to the top of their scope and really, I think that's the most important. If you're working to the top of your scope, you can do what's in your control to the highest ability to take care of that patient. And I know I've heard from CHWs that have said, Quisha, I'm not working to the top of my scope. Like, my manager doesn't know what to do with me. I can do so much more, and they have me at the desk. And so, or I'm filling in for, the scheduler because she's on maternity leave. So if you are an organizational leader and you have a CHW staff, I will encourage you to become more familiar with their scope of work, with exactly what they can do within that multidimensional skill set, and utilize them to the top of their skill set. All right, Tasha's back. This is how we roll. Alicia said, I love that you just jumped right in. This is how we roll. It just, as you can see, it just comes naturally. All right, Tasha, go ahead and wrap us up with making the business case for CHWs, please.
All right. So we have these 8